Well, first of all, it's raining. Our signature trademark for all of our events, but we wouldn't want to break a tradition because it always brings us good luck. So welcome to everyone. Thank you much for being here for this very historic and joyful press conference. I want to thank all of you and all of our guests for being here. I would also like to acknowledge some of the representatives who are here with us today. We have Jim Culbertson, who is representing Senator Kathy Young. Thank you, Jim. Brian Pellegra, who is representing the office of Congressman Chris Collins. Annie Chuico, who is representing the office of Senator Patrick Gallivan. And in person, we have our Assemblyman Bill Noje. Representing the town of Dansville is Mayor Peter Vogt. Thanks, Pete, for being here. At this time, I would like to invite to the podium the president of the University of Rochester, Joel Seligman.
Thank you. And I'm here to share Amy's joy. This is a big day for the University of Rochester Medical System and for Noyes Memorial here in Dansville. We look forward to building on close to 2 years of careful preparation for this affiliation. It was led on our side by Mark Todman, our Chief Executive Officer and Dean of our School of Medicine, who'll speak in just a few minutes, Steve Goldstein, who's with us today in the back. It represents a recognition by us of the importance of community hospitals to our region. It represents also a recognition of the quality of Noyes Memorial. We're here to tell you we're looking forward to working with you, and among many other things, we're here to do everything we can to ensure Noyes Memorial is here to stay. This affiliation did not happen overnight. It's one that reflects years of collaboration. We already have UR Medicine working in cardiology, family medicine, imaging, pulmonary, neurosurgery, and telestroke. And just a few weeks ago, we began a wonderful project which also involves Jones Memorial in Wellsville with the new Myers Cancer Center where we broke ground. I am particularly delighted today that we're joined by someone very familiar to you in Dansville, a member of our board, Phil Saunders. There's something kind of moving about not only seeing Phil again, but driving past the Saunders Surgical Center and knowing that the emergency department is dedicated to his late daughter, Mary. For the University of Rochester, we have a commitment to provide a regional healthcare system. And this is a concept that has become national in consequence. It is a recognition that at a time of great challenges in terms of the future of healthcare finance, uncertainty as to whether we'll see changes in delivery systems, the impact of electronic medical records, the nature of competition. Many community hospitals have sought to work with a partner like UR Medicine. In our case, not only are we committed to our region and determined that there'll be quality health care throughout the entire region, but we see this as, Mark Todman sometimes puts it, a win-win situation. We have very high occupancy at Strong Memorial Hospital. Our job is to basically help you keep as many patients as possible here. But there are some very serious cases which can receive better treatment in Strong Memorial or sometimes Highland in Rochester, and we'll be a good partner in facilitating that treatment. There are other advantages to this partnership. Over time, we expect we'll see them in the ability sometimes to share back office operations, sometimes to provide you more docs or, if necessary, nurses, sometimes to develop additional services. These are the efficiencies that are possible when you're part of a system. But we welcome you in a spirit we associate with the University of Rochester. We don't want just a partnership, we welcome you to our family. And what we mean by that is family members look out for each other, particularly in emergencies. Family members are there not only, as Amy has suggested, when it rains, but I've heard tell that occasionally it snows in this region here, and will be then here as well. Our motto at the University of Rochester is something we're very proud of, Meliora, or ever better. And what we're really celebrating today is an affiliation that will guarantee to Noyes Memorial ever better healthcare into the future, and for the University of Rochester, a wonderful new member of our family, a wonderful new partner. Thank you very much.
Thank you, Joel. We too are looking forward to our affiliation and how it will ensure for the future the best possible care close to home and access to specialized treatment when it's needed in Rochester. Affiliation is the final step in months, actually years, of discussion, due diligence, and board approval. As many of you know, we currently collaborate with UR Medicine to bring specialists, and actually in our community, we've had specialists from the university coming down here in clinics either at Geneseo or Dansville for well over 10 years. So we've had quite a long relationship. And those specialists include medical oncologists, pulmonologists, neurologists, neurosurgeons, and soon radiation oncologists as we move to open the Ann and Carl Myers Cancer Center, which will be open, I can now say, in less than 2 years. No pressure there, Deb. The process to identify a partner in healthcare for us actually started all the way back in 2010. So this has been 5 years of work by our board, our administration, our medical staff to really vet out who is a good partner for Noyes. And it isn't just Noyes, but it's our community. Healthcare delivery and reimbursement is changing in such a manner that we need to be part of a regional delivery network. If we were the wealthiest hospital in the state of New York, I wish, we would still be partnering to be part of a delivery network. Becoming an affiliate of UR Medicine is truly the best of both worlds. We retain the community hospital setting, but we continue to have access to and support from a world-class academic medical center. We hear from patients and their families every day how important it is to have access to high-quality health care close to home. This affiliation agreement will produce positive health care outcomes for our patients, along with efficiencies that reduce costs and even more opportunities for specialists, services, and programs while continuing our important role as a community hospital. I very much want to thank the employees of Noyes. We have gone through a lot in 5 years, and we did it together, and you should all be very proud of where we are today. I want to thank our medical staff, our board who had the vision to bring us here. It's very hard for a board to look at something that's been an isolated community entity for 100 years and say we need to reach out and be a partner with someone. Thanks to Dr. Todman, to President Seligman, to Steve Goldstein. And before Mark, we worked with Dr. Brad Burke, who brought us halfway through this process. All of us at Noyes Health look forward to our continued work together. And now I'd like to invite Les Cole, who is our board chair. And before you come up, Les, I do want to thank our 2 former board chairs, Mike Johnson and Marilyn Moore, who were very much a pivotal part of moving us through this process. Thank you.
Well, it's a great day for Noyes, and a great day for URM, and even greater day for the communities we serve. It has been a long process, and I'm very proud to be part of that process, but also our medical staff, the board, everyone that worked so hard on this. Amy and her staff, I can't tell you how much they did, work they did, and leadership she has provided all of us. So I just want to thank everybody, and God bless us, and God bless everybody that comes in the future. Thank you.
Thank you very much, Les. I would now like to introduce the CEO of the University of Rochester Medical Center, and if that's not enough to keep you busy, Mark is also the Dean of the Schools of Medicine and Dentistry, Dr. Mark Todman.
Thank you, Amy and Les, and I'd like to also thank the staff of Noyes Health and also welcome Noyes to the UR Medicine family. One of the things that is so important to us is that we can provide the highest quality care to everyone. And in order to do that, we need to partner with the highest quality institutions. And I think that what has been clear to me in the dozen years I've been in Rochester is that Noyes Memorial is a high quality institution, and it's exactly the kind of institution that we'd want to partner with. I'd also like to acknowledge Steve Goldstein, who really led the team that did most of the work on behalf of UR Medicine in terms of this affiliation. And to note that earlier this morning, we announced an affiliation with Jones Memorial Hospital in Wellsville. Eva Benedict, who is the CEO, is with us today, as was Amy down in Wellsville. And also, as you know, we are working with St. James Mercy in Hornell, and we hope that this also will result in an affiliation that will allow us to do something very special. A couple of weeks ago, we were here for the groundbreaking of the Myers Cancer Institute. And at that time, I mentioned really there were two groundbreakings, one for the Cancer Institute, but the other for an approach to regional health care. And really an approach that I hope will serve as a national model. We know that healthcare costs need to be reduced, but we also know that we need to provide, in doing so, we need to provide the highest quality care at the lowest cost. And this is something you hear around the country, but what I need to stress is this is not just for big cities. We need to be able to provide that same high quality care at low cost for every person in this country and for every region in the country. But there are real challenges for more rural regions. And the Southern Tier is a perfect example of this, where there's a very large area with a relatively small population in many towns. And this provides challenge. As healthcare has moved from the inpatient side to the outpatient side, it becomes harder and harder for hospitals that at one point had 80, 90 admissions to survive alone under the same situation. As we move from fee-for-service to what we call population health management, where we take responsibility for population, in order to do this well, we need large populations to make it efficient, to provide the best service. All of this really begs for an integrated approach in which we provide a healthcare system for the entire region. And that's what we have been working with so diligently with Amy and Eva, and what we hope to expand for all of the southern tier with our partners in Hornell. And will provide a model where, more than anything else, patients will be able to be taken care of locally. We know that what it means to really provide high-quality care is that patients want to have their care as close to home as possible, right? And so for us, it is building programs that allow more and more patients to stay in Dansville, to stay in Wellsville, to stay within the region, and to get this care here. It really does mean that building new programs and strengthening the communities, which not only will be good for the patients, but we will believe will be good for the local economies. And as Joel mentioned, it's also good for us. The economy of scale will allow us to take care of a population in the best possible way. Also will free space for the highest acuity patients who can't be taken care of locally. And the best way we can do that in a hospital that's already over 100% occupied is to try to drive as many of the patients locally by providing the best care. So this really is a model of what I think healthcare will look like in the future. It's something that we're very proud of. We look forward to showing the country how you can do this. And I'm particularly proud because of the partners we have. These are great institutions, and I think we'll be able to do something great, and I couldn't be happier. So thank you all for coming, and the best is yet to come.
Thank you very much, Joel, for being here, for Mark, and Les for your words also. So, onward we go, moving forward. Now different work is beginning, because now we get to reap the benefits of this partnership for our community and for our patients. So thank you again very much for joining us today, and please help yourself to some refreshments. Thank you.